And welcome to today's webinar on the timely topic of occupational health and cancer. My name is Ginevra and I am the Communications Officer at the Association of European Cancer Leagues, also known as ECL. And I will be your host and moderator for today. And as part of a webinar series focusing on different messages of the European Code Against Cancer, today's webinar is co-hosted with the Health and Environment Alliance, HEAL, as well as the European Trade Union Institute. And I'm delighted to be having here with me Jenon Jensen, the founder and director of HEAL, Tony Musu from the Trade Union Institute, William Taillet from the European Commission, and Christos Tsagkaris from ECL's Youth Group. And I hope you are all prepared and excited to learn more about occupational cancers, human carcinogens, and focusing on the carcinogens and mutagens directive as much as I am. In terms of the agenda, I'll just go over a few housekeeping items. Jenon will then say a few words about why we picked this particular topic for today's webinar, and Christos will give a brief overview of the European Code Against Cancer, as well as the activities of our youth group. Then Tony will present for about 20 minutes, and he will then take some questions on his presentation. Then William will present for about 50 minutes, and we'll also take some questions before wrapping up with a short quiz, just to test your knowledge and your memory of what you've seen in the presentations. And then we'll have some concluding remarks from my colleague David. So just a few housekeeping. Attendees are view-only participants, so you will be able to interact with us and to ask questions by tapping into the chat. So please use the chat, not the Q&A at the bottom of your screen. And please ensure to address questions to both panelists and attendees so that everyone can see them. Another thing is, after the webinar is over, you will be directed to a short feedback survey. It's very short, 6 questions, and we value your feedback. So please just ensure you take a minute to answer the 6 questions. Just a reminder that the webinar is recorded, so don't worry about taking notes or anything like that. And early next week, you will receive a thank you email with both the recording and the presentation slides. So without further ado, I will just hand over to Jenon, the founder and executive director of HEAL. Jenon, the floor is yours.
Thank you very much, Geneva, for hosting this and introducing this webinar today. I'm really excited to be here. For those of you who don't know, HEAL is a leading European not-for-profit membership organization showing how reducing environmental pollution can actually help prevent diseases like cancer and promote and protect health. We have about 80 member organizations, including ECL and some national cancer societies, as well as international, European, national, and local groups of health professionals, not-for-profit insurers, patients, citizens, women's, youth, and environmental experts representing over 200 million people in the European region. So with that, I would like to start say a few words about why this topic is so important for us and how we could work together in the future. With more than 100,000 deaths per year, cancer is the #1 work-related cause of death in the European Union. 53% of all work-related deaths are caused by occupational cancer. This is shocking, and it has to change. These figures require, we believe, an EU-wide response with adequate prevention strategies and protection measures, especially considering that at the moment there are very large differences in the level of protection of workers from one corner of Europe to the other. Cancer does affect us all. And personally, I lost my mother to cancer over a decade ago, just before presenting at the Canadian Cancer Society conference on pesticides and people's health. And it has really motivated me to work with HEAL members like ECL on primary prevention of cancer through environmental action. We at HEAL are really enthused to contribute to this webinar and learn more about what the trade unions are doing and the Commission. and also really excited about the EU's Beating Cancer Plan and consultations, which were launched earlier this month. We really think it's a huge opportunity to prevent cancer also through the environment. We were really encouraged to see ECL's vision released earlier this week prominently feature environmental factors and recommendations to protect people from carcinogens in the environment and at the workplace, including chemicals, pesticides, endocrine disrupting chemicals, and air quality, all topics that we at HEAL have been working on and advocating for the past 15 years. We really look forward to continue our work together with ECL and ETUI today, and to make sure these priorities are properly addressed by the European Commission in their cancer plan, within the Green Deal, and other major promises made by the EU Commissioner President von der Leyen, such as the promises towards zero pollution and to create a toxic-free environment. I'm also really looking forward to collaborating with everybody who's on this call. So thank you for giving us this space, and I'm really looking forward to hearing the other speakers and the discussion. Thank you.
Thank you very much, Janon, for sharing your personal story and also about the great work that HEAL does. And HEAL is definitely a leader when it comes to environmental and occupational health here in Brussels, but also at the European level and, if I might say, globally as well. And I agree with you that the European Beating Cancer Plan is definitely a huge opportunity for all of us who works not only on cancer, but on NCDs and on preventable diseases. So thanks a lot again. And Chris, you're up.
Okay, thank you very much for the floor. Hello, thank you very much for the floor. It's a pleasure to be in this workshop today. As you can see in this slide, the European Code Against Cancer is an assembly of 12 instructions that are really simple. It goes from quit smoking to protecting ourselves against radiation. The point of being simple is that this is something that we can do in our everyday lives, and this is very important. But to make sure that we can do it in our everyday lives, we need to communicate this information. And to communicate this information, we have a network of youth ambassadors. This network, we can move to the next slide.
Yeah, sorry, it's not passing. I'll just stop sharing and start again. Let's try again. Yeah?
Okay, exactly. So we have 12 simple instructions, but to make them happen, we need to pass the word. We need to pass the word to everyday people like you and me, and we need to say to them, stop smoking, you need to lose weight, and so on. But we also need to communicate with stakeholders and local and national authorities in order to ask them to be more proactive when it comes to tobacco control or to radio protection in the workplace environment. So for this reason, all of us, we are doing our small part in this effort. To give some more details, let's see the statistics about the ambassadors. We have a network of 55 active young students or professionals from all over the WHO European region. In total, there are people from 53 countries, as you can see here. And as far as the activities we are organizing, we either work together, so we have joint actions, or we work on our own, we have individual actions, or both. When it comes to cooperative work, we have webinars, Twitter chats, promotional videos, as well as physical events like workshops and lectures that we carry out together. We are doing this all over the year, but of course we intensify these efforts in specific occasions, such as the World Cancer Day or the European Week Against Cancer. When it comes to individual actions, we have a wide spectrum of activities, from conventional ones like presentations, lectures, and workshops about the European Code Against Cancer, to more complicated ones like research projects or awareness campaigns, and to even more alternative ones like marathons or artistic exhibitions. And all of them are doing their part in promoting the code. There are a lot of activities so far, and there is a lot of inspiration, but at the same time there is a lot of autonomy, so each of us can create projects and carry them out according to his interests and to the fields that he is more familiar with. In my case, I really like traveling to conferences. So my experience in the European Code Against Cancer was a chance to amplify the word this way, delivering workshops in several conferences like the one in Sofia. You can see the first slide, the International Medical Students Conference in Bucharest in the second photo, an exchange program in Taipei, Taiwan in August, and the Assembly of the European Medical Students Association. At the same time, our involvement in the European Code Against Cancer allows us to combine it with other roles we have at the time. For example, it happens that now I serve as editor-in-chief of the European Student Think Tank. This is an NGO and a magazine that is based in the Netherlands. And due to my involvement here in the European Code Against Cancer, we started a campaign about the World Cancer Day. We published articles about this. And I also had the chance to conduct some literature research concerning the cancer code and liaise this to some conferences I'm going to attend and help organizing. So it is a combination of autonomy and of inspiration and collaboration from the previous activities and the other ambassadors. And this is a really nice environment. You can also see the handle that we have created together, the other youth ambassadors from Greece. So all in all, we now have a new call for ambassadors from specific countries this time. So if you come from these countries, you are young students or professionals and you are interested in working like this, feel free to apply. And if you want to stay connected with us and our activities, you can always follow our social media, as you can see here. Thank you very much.
Thank you very much, Christos. I'm just taking a second to stop sharing my screen and to introduce our first keynote speaker, Tony Musu. Tony holds a degree in chemical engineering from the University of Brussels, as well as a PhD in science from the Pasteur Institute in Paris. And he's been working as a researcher, now currently a senior researcher, since 2003 in the European Trade Union Institute's Health and Safety Department. Where, amongst other things, he takes part in various REACH-related EU working groups. And before this, he spent 5 years as a researcher in the private sector, dealing with the safety assessments of chemicals. Tony is also a member of the ad hoc working group on chemicals within the Luxembourg Advisory Committee on Health and Safety at Work, and was a board member of the European Chemicals Agency from 2007 till 2012. So Tony, the online floor is yours. Please go ahead and share your screen.
Okay, thank you very much. I hope that you all hear me very well. So I've been asked to sum up what we know about occupational cancers. And so I've titled my presentation 10 Facts That You Should Know. These numbers have been given by Jenan already, but cancer is the first cause of death at work, not only in the EU, but also in other developed countries. And as you can see, more than half of all deaths at work are due to cancer, work-related cancer. For example, when you compare it to accident that's only 2.4%. Most of the time we think that accidents are the reason why people die at work, but no, this is not true. The first reason, that's again occupational cancer. And here you have a distribution of deaths in all EU countries. And as you can see, for example, for Germany, almost 8,000 people, more than 12,000 for France, and so on. So each year, a huge number of deaths due to occupational cancer. All those cancers, and that's my fact number 2, are invisible. And there are, of course, many reasons why these cancers are invisible. The first reason is that we have a long latency between the exposure to carcinogens at work and the onset of the symptoms. And of course, when you are treated for a cancer, the doctors, they cannot see the difference between tumors that are of occupational origin and those of other origins. And also, we know that physicians, they seldom ask, what was your occupation? You know, they don't think of asking this very simple question to sometimes make the link between the occupation and the cancer of their patients. We also have to acknowledge that most of the time patients, they are unaware that they've been exposed to carcinogens at work, and that's of course a big problem. We have in the EU different cancer registries, but in those registries there is no data on the patient's work history and the occupations of those patients. And if we had this kind of link, it would be easier to make the link between the occupation and some of the cancers that we have. And we know that in all countries, occupational cancers are underreported and under-recognized. So with the cancers that are recognized and compensated are only the tip of the iceberg, and we know that we have many more in all EU countries. Third fact is that women's occupational cancers are even more invisible. So we have a stereotype which most of the time is linking work-related cancer with males. But women are also exposed to carcinogens at work. And you have here a table with the so-called attributable fraction. So attributable fraction are can be defined as the percentage of cases that could have been avoided if there had been no exposure to the suspected risk factor. So in other words, that's if you take all cancers, that's the share of these all cancers that can be attributed to work. And as you can see, for both genders, that's between 6 and 12%, but for women, that's less, that's between 3 and 7%. So these numbers are clearly probably underestimated for women, and there are many reasons for that, but I won't enter into the details. Fact number 4, that's the so-called social inequalities in health. As you can see from this table, extracted from a survey made in France, we can say that blue-collar workers are much more exposed to carcinogens at work compared to the so-called white collar. And that's very clear. When you are a blue-collar job worker, you are much more exposed to carcinogens. Fact number 5. So here you have an example of some of the carcinogens that you can find at the workplace. You have, for example, tobacco smoke, of course, but you have asbestos, which is a well-known occupational carcinogen. You have chromium-6. You have some process-generated substances like wood dust, crystalline silica, but you also have the shift work, and we had a number of publications now linking shift work, for example, in the healthcare sector to breast cancers. And of course, you have many more, and you all know the classification and labeling system that we have in the EU, with carcinogens classified in different categories according on whether it is a known carcinogen, a presumed carcinogen, or a suspected human carcinogen. And when you look at the data that we have more than 1,200 chemicals that are classified officially in the EU as carcinogens, but we have even many more that are self-classified by manufacturers or suppliers of those chemicals. But we can say that, of course, we have major carcinogens, and if I refer to my previous slide, we can say that maybe 50 priority or 50 carcinogens are causing, let's say, 80% of the exposure at the workplace, because that's always the same group of carcinogens that we can find at the workplace. My fact number 6, and that's the strategy that is used by industry for now decades. And I refer here to 2 excellent books that you can read. The first one is in English, the second one is in French, and that's the doubt that industry is putting on their hazardous products just to delay the legislation, and that's also the so-called paralysis by analysis. And we have many different examples. Asbestos, of course, is a well-known one. Tobacco smoke is another. And these days on the cinemas, on the screens, you can see an excellent movie which is called Dark Waters, and tells the story of a nasty chemical produced by DuPont, which is a PFOA, and that we can find in our cook pans, for example. The cost of cancers are huge. We did a study a few years ago to try to monetize the cost of occupational cancers in the EU. And as you can see from this slide, they are estimated between 270 billion euro and 610 billion each year in the EU, which is up to 4.1% of EU GDP each year. So what are the costs that have been monetized? 3 categories. The direct costs, that's the cost for healthcare, the treatment of the cancers. You have the indirect costs, and that's for example, the productivity losses that we have, that companies have due to absence from work, or also premature death. And then you have the so-called human cost, and that's the cost of the reduced quality of life for patients and their family. And when you try to understand who bears these costs, as you can see, most of those costs are on workers and their families, but also employers have huge costs due to sick leaves and productivity losses, and also, of course, the healthcare system and the social security in the different member states. My fact number 8, we, as you've seen, we have up to 12% of all cancers that are work-related. And of course, these cancers are preventable. They are preventable if workers are not exposed to carcinogens at work. And that's why we always insist on the elimination or the substitution of those carcinogens in the workplaces, but also the reduction of exposure. And as you might know, we have in the EU some legislation to try to prevent those work-related cancers, but they need to be improved. Basically, we have 2 types of legislation: the marketing and the rules for the marketing of chemicals, and then the rules for the protection of workers. And we have some common elements there. That's always the need to do a risk assessment and to push for substitution. And if we go quickly to those legislation, so we have, for example, the REACH regulation that you might know, based on the principle no data, no market. So it means that companies putting chemicals on the market, they need to provide data on their substance. But when those substances are of very high concern, if they are, for example, carcinogens, they will need to obtain an authorization. And we also have under REACH some ban of chemicals or some restrictions. For example, a well-known one is the ban, the total ban on asbestos that we have in the EU. But we know that the legislation is slow, for example. So we have very good rules, but it's quite slow in identifying substances of very high concern. We know, for example, that the authorizations that are granted to companies most of the time are granted by default. So we have very few cases where these authorizations have not been granted. And the restrictions that we have most of the time, they are quite narrow. So good rules, but needs to be improved. And that's the same for the pesticides and the biocides regulation. As you might know, companies, they need to obtain an authorization at EU level for the active substances. But we have many derogations, and for example, formaldehyde, which is an important carcinogen, is still used as a biocide, and glyphosate, for example, has been failed to be identified as a carcinogen. And again, that's one of these cases where companies have put doubt to delay legislation. So this is the piece of legislation related to workers' protection. That's the so-called Carcinogens and Mutagens Directive. The aim, of course, is to protect workers, and employers have a set of obligations. The first one is to eliminate or to substitute a carcinogen with a safer alternative. And if it's not possible, they need to use a closed system. And if still not possible, they need to reduce the exposure as low as technically feasible. And that's where we have the so-called occupational exposure limit values. So that's the maximum concentration of a substance that is allowed in a workplace in order to protect workers. And so again, here we have good rules, but very few limit values have been defined for carcinogens. We only had 3 on 26 years. And we need, of course, to improve the system and adopt additional limit values. I won't go into the details because William, the next speaker, will tell you more about this. And finally, my last fact is that we can work all together to eliminate occupational cancers. And 4 years ago, the roadmap on carcinogens has been adopted by different organizations. We have member states, but also the trade unions, employers, so Business Europe, ETUI, the umbrella organization for all the trade unions, have endorsed these roadmap. And the idea is to raise awareness about occupational cancers, but also to collect good examples or good practices on how occupational cancers can be avoided. And of course, you can become friends of this roadmap, and I invite all of you maybe to have a look on that website and become friends. Thank you very much for your attention. You have here some of our publications if you want to know more on occupational cancers. And with that, I hand over the mic to Ginevra.
Excellent. Thank you so much, Tony, for this concise overview of occupational cancers and yet comprehensive overview. And I really liked the format as well, like a facts-based presentation. So it was really nice also to look at. I think we have about 4 minutes for questions on Tony's presentation, and we had a couple that popped in during the webinar. So I'm gonna pose this to Tony already. The first one, I think it might have been answered in your presentation already. Someone was wondering, you know, since occupational cancers are invisible, how can we actually calculate the proportion and the incidence of occupational cancers? And the second one, on a similar vein, is about occupational cancers are invisible. So are there any good initiatives out there to kind of collect higher quality epidemiological studies?
Yes, so to the first question, indeed, occupational cancers are invisible, but we have some methodologies to try to estimate the share of all cancers that are caused by work, and the attributable fraction is the one used by researchers, and for that you need to know, for example, the relative risks of having a cancer for a particular carcinogen, and you also need to know the number of workers that are exposed to that carcinogens. And of course, the attributable fraction, that's a methodology that is debated because it can underestimate it in sometimes the share of all cancers that are attributed to work. But this is the methodology that is used to estimate the share of all cancers that are caused by work. The second question was how to make visible the invisible cancers and what are the initiatives that we have. In my presentation, I talked about the registries that we have on cancers, and sometimes in those registries, you have information on the occupation of the patients. And that's exactly what the Nordic countries have done. And in their cancer registries, they have those types of information. And we have, for example, the NOCA project, NOCCA project. And from that project in the Nordic countries, you can make links really between the cancers and the occupations. And so that's one of the rare registries that can be used to make those links and to know more about occupational cancers.
That's great. I think we only have time for one question left. I've got one. Why are occupational cancers in women even more invisible? Is there any particular reason for that?
Okay, I have now unmuted my mic. So the reason is that all the scientific research and the papers that we have in the literature have focused on male occupational cancer, because there is indeed this belief that males are doing the dirty jobs and are therefore exposed to hazardous substances and so on. But of course, this is not entirely true. And we know, for example, that women are also exposed, and take the example of nurses in hospitals. They are exposed to many different types of carcinogens. Take, for example, the cytostatic drugs that are used to treat patients, for example. Those are also carcinogens. And when nurses are injecting these drugs to cancer patients, they are also exposed to those drugs, and they can get cancers. So these types of exposure were not really the focus of all the scientific papers that we had on occupational cancers. So that's some of the reasons why women occupational cancers are clearly underestimated.
Great, perfect. Thank you very much for taking these sets of questions. And for time's sake, we'll have to go ahead. So allow me to introduce our second keynote speaker, William Taillet. William has a background in business management and economic sciences. He currently works as a policy officer in the Health and Safety at Work unit at the European Commission's Directorate General for Employment, Social Affairs and Inclusion, where, amongst other things, he's in charge of the fourth revision of the Carcinogens and Mutagens Directive, the CEMD. And prior to this, he was a parliamentary assistant at the European Parliament, as well as an advisor for the Belgian Trade Union. So I'm going to try to share my screen with this presentation. Here we go. So William, the floor is yours.
Okay, thank you so much for giving me the floor, and thank you also so much for inviting the European Commission to take the floor on this very important topic, which is the protection of workers from carcinogens and mutagens directive exposure. Sorry, because I mean I know that you will be, or you will have to share my PowerPoint and to manage it. So I know this is probably not so easy for you to do. But well, it seems that we are now facing some important problems with our IT system here in Luxembourg. Okay, so I just would like to start a presentation with this question: why is there a need to act? And I think that actually Tony already partly replied to this question. As you know, cancer is the first cause of work-related deaths in the EU. Cancer is responsible of half of the occupational deaths in the EU, and I think that when you are aware of these figures, of course, that you think that there is a need to act. And I also would like to insist on the last bullet point of this slide. There is a strong desire from all stakeholders to tackle this issue and to talk together and to establish additional occupational exposure limit value. So it shows also that this is a matter of concerns for all the stakeholders. Next slide, please. Thank you. So there is a need to act, and actually this topic is a priority for the Commission, and I would like to show you that via two things. The first of all, I would like to refer to the communication of the Commission on a safer and healthier work for all, and actually you can access this text by clicking on the link which is on my slide. But if you look at this text, the Commission identifies its top 3 occupational safety and health actions. And one of these top 3 is the fight against occupational cancer and exposure to chemical. And actually the Commission says that, well, it is very important to revise and adopt new EU limit values for the most dangerous substances. So it shows that, well, this is a priority for the Commission. Next slide, please. Next slide. So the fourth slide. Okay, next. Okay, fine. And I also would like to refer to the political guidelines of our new president of the European Commission, Madame von der Leyen. I will not read, of course, all the paragraph, but just to mention that she would like to put forward a European plan to fight cancer. It has been announced in front of the MEPs last year, and since then, Madame von der Leyen, together with other commissioners, organized a conference earlier this month to launch the public consultation on this plan. And this is a very important moment because it is a moment where people, stakeholders, can share their views, their experiences to feed into this plan. And I saw, for example, that ECL published a position paper on this European plan to fight cancer. And I think if maybe that you have already done that, but if not, it would be, of course, great to share all these views in the context of this public consultation. Next slide, please. And actually, this plan is now called the Europe's Beating Cancer Plan. This is not the most important, but it should be presented before the end of this year. And of course, the main question is what will be the content? Well, it is a bit, of course, early to reply to that question. There is an ongoing public consultation, as I told you, but we already know that this plan should propose action for all stages of the disease. So it means prevention, diagnosis, treatment, quality of life of patients and survivors. These are the 4 pillars, or these should be the 4 pillars of this plan. And if you look at the prevention, you can see that we should have actions to reduce the exposure to carcinogen in the workplace. So this is very, very important regarding the topic that we are discussing today. Next slide, please. Okay, so there is a need to act. This is a priority, and actually we already have a piece of legislation dealing with this issue, which is the CMD. I will not insist too much on this slide, not spend too much time on this slide because Tony did it very well. But just to reinforce what he said, there is this hierarchy of obligation in the directive. These are the Article 4 and 5 and the Annex 3, meaning that, well, there is this obligation of substitution. If it's not possible, closed system. If it's not possible, again, the employer is obliged to reduce the exposure as low as technically possible. And as soon as there is an OEL in the Annex 3, the employer has to make sure that the exposure can never be above this OEL. But even if you have an OEL, it does not prevent the employer to try to substitute the chemical. So this is something which is very important to keep in mind. Next slide, please. Okay, so we have a piece of legislation, the CMD. This is not a frozen text. This is not a frozen text in the sense that, well, it has been published in 2004, but since then, the Commission already proposed 3 revisions of this directive in order to mainly to add additional occupational exposure limit values in the Annex 3. And thanks to that, these 3 revisions, we succeeded to address 26 substances. And I will come back to that later, but we are currently working on a 4th revision of this directive. So next slide, please. This one is probably the most important one. There are a lot of content on this slide. I'm sorry for that, and it could be a bit dense, but well, I will try to actually summarize the process that the European Commission follow when proposing some new occupational exposure limit values, because I think this is very important for you to know how does it work. How do we do that when we propose these new OELs? So first of all, there is what we call the selection of the chemicals, because unfortunately we cannot address all the chemicals at the same time, meaning that we have to do a sort of prioritization. And how we do that? What we do, this is DG EMPL, which is responsible for that, but we consult other people, other sources to do so. And this is, for example, the case with the stakeholders, with the social partners. We consult the social partners before selecting all the chemicals. Then, as soon as we have prioritized all these chemicals, we are going to ask the RAC, the Risk Assessment Committee, which is a committee composed by scientists, to carry out a scientific evaluation and to recommend an occupational exposure limit value under which there is no risk anymore for the worker. Of course, when it is possible. As soon as we have this recommendation of the Risk Assessment Committee, this opinion will be discussed by the Advisory Committee on Safety and Health, and more specifically, its working group on chemicals. This is a working group composed by representatives of governments, employers, and employers. It means that this is a tripartite committee that will discuss the opinion of the RAC, and they will also do an opinion for the Commission with a recommended OEL. What they are going to do, they are going to take also into account some socio-economic aspects before proposing an OEL to the Commission, which means that sometimes you can have some differences between the OEL recommended by the RAC and the OEL recommended by the tripartite committee. Then, as soon as we have both these opinions, we are going to do what we call an impact assessment. It means that we are going to assess the impact of different scenarios, different OELs for each substance. So economic, social, and environmental impacts. And it is on that basis that we are going to take our decision as European Commission on which OEL should be proposed to the co-legislators. So this is a very important moment. And of course, that the opinions of the RAC and the advisory committee are duly taken into account during this process. Then, as soon as we have done this impact assessment, we draft the legislative proposal that will be discussed by the College of Commissioners and hopefully adopted by the College of Commissioners. This is an important moment as well. And as soon as it is adopted, it is proposed to the co-legislators. This is the ordinary legislative procedure. So they have the right to amend the text. And as soon as they have amended the text, each of them, I mean, we are going to do what we call the interinstitutional negotiation. So meaning that the Council and the European Parliament will need to find a common text, a common agreement that will be the final revision of the directive that will be published in the official journal of the EU. I hope that I have been clear, because I know this is a lot of information at the same time, but this is very important for me to explain you what is a procedure of the European Commission. This is a very comprehensive procedure during which we consult a lot of stakeholders. So next slide, please. I will not insist too much on that one because I have already mentioned the main stakeholders and their importance. So I'm going to ask you to move on to the next slide, which is not also important in the sense that I have already mentioned the fact that we consult a lot, all these stakeholders. So next slide, please. CMD4. As I told you, we have already proposed 3 revisions of the CMD, and we are currently working on a 4th revision. This 4th revision should address 3 chemicals: acrylonitrile, benzene, and nickel compounds. Regarding benzene, we already have an OEL at the EU level, but we consider that regarding the latest scientific advances, we should revise this OEL. So I would say that the work is progressing well. We already have a scientific opinion. We already have an advisory committee opinion also for each of these substances, and we are currently writing the impact assessment. And we hope that the Commission will be able to present this new revision by the second half of this year. And then, if it is adopted, of course, it's going to be submitted to the Council and to the European Parliament. So this is I agree with Tony in the sense this is a process that sometimes takes a long time, but I think that it is really needed to consult all the stakeholders, and this is also an obligation for us to respect the ordinary legislative procedure. So next slide, please. So what are the challenges? Because of course, if you want to tackle such important issue, which is the protection of workers from exposure to carcinogens, you need well-drafted legislation, I would say, but legislation alone is not enough. You also need to make sure that it is well implemented at the workplace, and it is particularly the case for the small and micro companies, because sometimes the SMEs are not fully aware of all the obligation that they have to comply with. So this is also the role of the national authorities to make sure that all these SMEs are aware of all the obligation. This is very important. And in addition to that, it is not just about legislation. We also need supporting actions. You have here some different actions. I will, for example, mention the EU OSHA campaign. It is a very important campaign just in order to raise awareness around this problem. So the legislation is important, but we need more. But I want to make sure, and I want to be clear. I mean, all these other things cannot replace the legislation. Legislation is important. Next slide, please. And this is the last one of my presentation, looking to the future. As I told you, we have a new commission, and this is great to see that fighting against cancer is a key priority for this new commission. We have already presented 3 revisions of the CMD, meaning that now we got some experience that could serve us for the next revisions. I would like also to inform you, because this is very important, that we very recently mandated ECA, which is the European Chemical Agency, to carry out a scientific opinion on asbestos with the aim to revise the occupational exposure limit on asbestos. And last but not least, we have what we call a roadmap on carcinogen that Tony already mentioned in his presentation, which is I think a good platform also to exchange best practices between representatives of governments, employees, employers, European Commission, agencies. So this is a very important, in my opinion, platform. And very recently, the European Commission, together with all the other stakeholders, signed a document to extend this roadmap on carcinogens. And I think that by doing so, we also show our commitment to continue the job and to continue to better protect workers from the exposure to carcinogens. So that's it for my presentation. I hope that I was not too long. I know that I sometimes like to speak a bit too much. So I hope that I stick to the time given. Thank you very much for your attention.
Brilliant. Thank you so much for the clear introduction about the past, the present, and the future of the CMD. And thanks a lot also for mentioning ECL's position paper on the BT Cluster Plan. I think, of course, it is a very exciting time for all the organizations that are working on cancer and NCDs. And we will definitely use that paper as the base for our public consultation response. And great to hear also your insights on the fourth revision of the CMD and what's to come. And I think we're running a bit late. So what I'll do is I will compile all the questions that have been asked during William's presentation, and then I'll get back to the speakers to see if they will be willing to provide short written answers to those questions. And I will proceed with the interactive quiz that Christos has prepared for us. So what I'll do is I will launch it, so it will appear directly on your screens, and Christos will read the questions out loud to kind of give all the attendees some time to reply to the questions. So I will launch the poll, and you should be able to see it on your screen. So Christos, you can go ahead.
Thank you.
Yeah, so you can go ahead and read the questions.
Okay, I think I can't see them for now. I want to know if everybody has the same problem. Yeah. Just give me a minute. I will try to fix it. Okay, so question number 1. No, give me 1 minute, please. Okay, so number 1, more than 20,000 deaths, 100,000 deaths, 60,000 cases of lifelong impairment, or 35,000 cancer diagnoses are attributed to occupational cancer in the EU every year. So the options are 20,000 deaths, 100,000 deaths, 60,000 cases of lifelong impairment, and 35,000 cancer diagnoses.
Yeah, I'm seeing most people have answered the questions, and I think they're guessing right, so I think we can proceed with the rest. And of course, the attendees are free to answer all the questions one after the other.
Okay, question number 2. To decrease the incidence of occupational cancer, the European Union is taking measures so as to: option 1, decrease workplace exposure, decrease both workplace and environmental exposure, enforce the use of protective equipment without modifying the workplace, or allow employees to retire earlier. Question number 3. Occupational exposure values limits have been implemented in the 4th batch of the CMD regarding: A. Acrylonitrile, B. Benzene, C. nickel compounds, D, all the above. Question number 4. The need to improve the implementation is more obvious in A. Small and medium companies, B. Large companies, C. Civil society, D. Public sector. Question number 5. Cancer is the cause of death at work in the EU. So is it the first cause, the second cause, the third cause, or the order is not known? And last but not least, whose groups occupational cancers are largely neglected by the epidemiological studies? Who is the neglected group? Is it men, women, children, or elderly population? These are all the questions.
Perfect. I think we have quite a few responses, and what we'll do is we won't tell people the right answer, but in the thank you email, you will have the results from the quiz. And I thank Christos again and William again for your time, and to all the speakers. But before signing off, I will just let my colleague David, who is a cancer prevention manager here at ECL, to close the webinar with just some final remarks. And thanks to the almost 50 of you who have dialed in live today for the webinar. Thanks a lot.
So thank you, Ginevra, and thank you also to all of the speakers for a very informative and entertaining and excellent webinar we've had today on this important topic. Just to sum up some of the key points from our perspective, we've learned how there's a high burden of work-related deaths that are linked to cancer, and also, on the other hand, a high proportion of all cancers which are related to work-based exposure. So we've heard from the speakers the importance of this issue, both to the cancer burden more generally, and then within the work-related deaths itself, the high proportion that we have that are attributed to cancer itself. Another key learning from this webinar has been the social inequality perspective, in that blue-collar manual workers are those who are really bearing the brunt of the burden in this perspective. So action to reduce the, ideally eliminate occupational cancers would have a positive impact on improving health inequality, taking that into account. And we also made to reflect on the, not just the social and emotional consequences of the cancer burden from occupational cancers, but also this brings in itself the important economic consequences too. So this makes it an even more important and pertinent topic for society, for all actors involved in governmental sector and so on. So in conclusion, the time is right for us now to act on this crucial issue, and we have thankfully a great political commitment from the European level, not just with the proposed Beating Cancer Plan, but with other instruments coordinated by European Commission. So let's hope that this is really a beginning of further and more intense activity on this important topic in the future, and taking advantage we can altogether of these instruments and opportunities that are available. Thank you all for your time and attention and participation, and the recordings, the notes, and so on will be shared in the coming days after the webinar. So we'd like to wish you all a good weekend.